Hi there, I'm Kim, Quality Improvement Program Analyst at Central California Alliance for Health and part of the Alliance's Practice Transformation Academy team. Welcome to the third video in our series called The ABCs of Quality Improvement. I hope you found our first two videos, which reviewed writing SMART aim statements and creating project charters, to be informative and helpful. If you haven't already yet, make sure to check them out and look out for our contact information at the end of the video should you have any questions. Now, in this video, we will discuss what process mapping is and how you can use process maps to identify opportunities for improvement in your clinic. First, let's define what a process map is. Also called the flowchart, a process map is a visual diagram that depicts the series of steps in a process that produce an end result. Process mapping is a way to capture and describe particular processes in detail. This could be anything from how appointments are scheduled to how tests are ordered and tracked, even to the process of ordering a cup of coffee at your favorite coffee shop. That's right, the benefits of process mapping are not limited to work-related process changes. A few exciting aspects about process maps are that they make the invisible visible by bringing to light the steps detailing how a process is carried out. They're also a useful tool in revealing hidden inefficiencies in a workflow and aid in building consensus among your project team and clinic staff around areas for improvement. Let's talk about the building blocks you'll need to create a process map. There are 4 basic symbols you need to know. First is the oval. It indicates the start and end points of the process. Second is the rectangle. Use these to show any task or activity in the process. This will generally be the most commonly used symbol in a process map. Next is the diamond. These represent a decision point in the process. Finally, we have arrows. These are used to show the direction of the process flow and should connect all of the steps in the process. We're almost ready to begin building our process map, but there are a few important tips to remember. Before creating your process map, you'll need to directly observe the process in action. It is very important to map what is actually happening, not what the clinic thinks is happening or wants to happen. To create the most accurate process map of the current situation, be sure to include input from frontline staff who know the process the best. It is also key to clearly define your start and end points along with the scope or level of detail of the process to keep things focused on the problem at hand. Finally, when getting together with your team to create a process map, you'll want to gather office supplies such as sticky notes, flip charts, and Sharpies, as they will allow you to visualize the process and are easily manipulated, so you can quickly modify the location of the steps of a process as needed. Flip charts are often the best and simplest tools for creating process maps, as they can be easily saved and transported. Now, let's walk through how to build a sample process map that depicts the steps of purchasing a beverage at your favorite coffee shop. Imagine you are the manager of a coffee shop, and in the past month, you have received an increased number of customer complaints about the wait times and getting the wrong drinks. You decide to gather your staff and materials to map the beverage purchase process, and this is what is described. The process begins when a customer enters the coffee shop. This is represented by an oval since it's the start point. Upon entering, the cashier takes, enters, and sends the customer's order to the barista. The cashier also asks the customer if they would like to order food with their drink. Since the customer has the option to order food with their drink, we use a diamond to represent this decision. Notice the arrows connecting each step and showing the flow of the process. While the cashier is ringing up the customer, the barista proceeds to make the drink. After handing the customer the drink, the barista performs a quality check and asks the customer if they were satisfied with their drink. The customer leaves the coffee shop if they are satisfied. If the customer is not satisfied, the barista proceeds to remake the drink, and the customer finally leaves the coffee shop with their drink in hand. Here, we see a second oval representing the endpoint of the process. Once you have the process map, you will have a much better understanding of the various steps involved, which will allow you to dig in further and identify the gaps or pain points. In order to locate gaps in the process, there are a few key steps to take. First, meticulously dissect each step in the process. Ask questions that will help you uncover gaps or pain points that may be affecting an individual step or the process as a whole. You'll want to ask your team, did we receive the right input or the right information and material from the previous step? Did we receive it at the right time? Was it of the right quantity and quality? Next, work with your team to identify and eliminate any waste in the process. In healthcare, there are 8 established types of waste. We'll discuss these different types of waste in depth in our next video on lean principles. Finally, it's time to brainstorm potential solutions. You'll be surprised by how many ideas your team comes up with, and then you can begin using Plan, Do, Study, Act, or PDSA cycles to test those ideas. We will share much more information about how to run an effective brainstorming session and PDSA cycles in later installments of this series. Now that we're more familiar with how to analyze process maps, let's apply those steps to our example. As the manager, you start by asking those involved at each step in the process, did you receive the right input at the right time in the right quantity and quality? Midway through the process, the baristas speak up. They mention that the quality of the drink orders they have been receiving have not been of the right quality. A significant portion of the time, it's very difficult to read the drink orders that are printed out. You continue to probe, asking when the printing issue occurred. Was it at specific times? And what made the printout difficult to read? You learned that the quality of the printout had not been the same for about a month now, something you were not aware of. One of the cashiers shares that the printer was also replaced about a month ago, and since then, they too noticed the order slips were difficult to read because of the tiny faded text. Bingo! This insight into one integral facet in the coffee ordering process has revealed the likely culprit for decreased customer satisfaction. Due to the poor quality of the drink printout, the baristas were misreading the drink orders and having to remake drinks more frequently, contributing to the longer wait times. You put a star next to this step to identify the opportunity for improvement. Because there could be multiple inefficiencies in the process at play, you will continue to analyze the remaining steps in the process before determining next steps. By capturing and highlighting each step in a process, as we just did, you can more easily dig into the details and identify potential areas for improvement that can have a meaningful impact. In our case, with a simple improvement to the order printing process, hopefully the coffee shop will return to shorter wait times and happier customers. While this was a fairly simple, high-level process map for ordering a drink at a coffee shop, please know that any process, especially those more complex, can benefit from the process mapping approach. Remember, process mapping is a way of making the invisible visible so you can look for ways to improve your processes to increase efficiency, reduce errors, and improve outcomes. By creating a process map, you and your clinic will be able to see what is really happening currently, identify opportunities for improvement or change, and design new, more effective processes. On behalf of the Practice Transformation Academy team and the Alliance, thank you so much for joining us. Stay tuned for our next video in the series, Lean Principles.